Measuring resting blood pressure. In this video, you will be taught how to correctly take blood pressure. It is important to accurately measure blood pressure because it is vital in the prevention and treatment of blood pressure related diseases. You will measure blood pressure using a stethoscope and a blood pressure cuff. Two important things to know are systolic and diastolic pressure. These will be explained later on in the video. Under special situations, supine and standing value measures may be used. Patients need to be quietly seated in a back supporting chair for 5 minutes, with arms supported at their heart level and feet on the floor. Patients shouldn't smoke cigarettes or take any form of caffeine for 30 minutes after measurement. The stethoscope ear tips need to be wiped down prior to use. The ear tips need to be facing forward when placing them in your ears. You will then slightly tap the chest piece to check if it's on. Some stethoscopes have an on and off switch that you turn. The fitting cuff side needs to be used for an appropriate measurement. The bladder inside the cuff needs to encircle at least 80% of the upper arm. Adults frequently require a large adult cuff size. You will place the cuff securely around the upper arm at heart level. Adjust the cuff to align with the brachial artery. You must make sure the cuff is tight enough. If not, it will slide down the arm and ruin the reading. The way to hold the chest piece is between your index and middle finger of your dominant hand. This will eliminate hearing your own blood pressure. You will then place the stethoscope chest piece over the brachial artery below the antecubital space. Before inflating, check that the cuff is closed. If not, air will be released. You inflate the cuff pressure quickly to 200 millimeters of mercury. You will release pressure slowly at a rate equal of 2 to 5 millimeters of mercury. You will have to hear for the first Korotov sound. It is described as the first snapping sound, and this will be your systolic pressure. You will then hear for the fifth Korotov sound, which is a disappearance of the sound. This will be your diastolic pressure. After finishing, you will allow the patient to rest for 1 minute. Another measurement will be then recorded and the average will be calculated. This chart describes the different categories of blood pressure. In order to fall under the normal range, systolic blood pressure must be less than 120 millimeters of mercury and diastolic must be less than 80 millimeters of mercury. If the patient's systolic blood pressure is higher than 180 millimeters of mercury and their diastolic pressure is higher than 110 millimeters of mercury, immediate emergency care is needed.